A motivated patient who is interested in improving their quality of life with better quality erections to treat erectile dysfunction are really the best candidate for a penile implant. I, of course, would sit down with you in the office and explain the risks and benefits of the procedure, but if the pills aren't working for you, and if the other options either aren't working or you are interested in pursuing those options, then certainly a penile prosthesis may be right for you. Many insurance providers, including Medicare, typically do cover a surgical implant with a penile prosthesis. Before we would embark on surgery, we would have our business office check your insurance and make sure that it is a covered benefit for you. The two main types of implants available are the malleable and the inflatable penile prosthesis. Most of the time we would use the inflatable penile prosthesis as it provides a more natural feeling erection in that you can pump it up to have the erection and then deflate it to return the penis to a soft state. The malleable or semi-rigid rods are ones that are always firm, and then you can bend it up if you want to utilize it for sexual activity, and then bend it down when you're done. The malleable implant or semi-rigid rods are two cylinders that go into the penis, and they are always firm. When you want to utilize it for sexual activity, then you would bend it up, and when you're done, then you can bend it down. The inflatable penile prosthesis provides a more natural erection in that you can pump it up, and there's a pump that would be located in the scrotum, and then the cylinders are in the penis. When you use the pump, it puts fluid into the cylinders to create the erection. Utilize it for sexual activity, and then when you're done, you can deflate it, and then the penis goes to a soft state and a more natural appearance of a flaccid penis. During the operation, we use a measuring device to determine the appropriate size of the cylinders that we use for an implant. This is something that we can't modify, we can't change it, so we put in the appropriate size for the patient. We aren't able to put in larger ones with the purpose of gaining length or size. The implant is easy to use. For the inflatable penile prosthesis, there is a pump that is placed in the scrotum, and that pump has two components. One, the larger bulb on the bottom is what you squeeze to inflate the device to create the erection, and then above it there's a smaller piece that you squeeze in order to deflate the device and return the penis to a soft state. The penile prosthesis will allow you to have a rigid erection. It will provide a firm penis for sexual activity. It does not affect orgasm or sensation or ejaculation. However you were before the procedure for the penile implant is how you would be after in those regards for sensation, orgasm, and ejaculation. So the implant is only providing a firm erection. The implant is completely concealed where you cannot see it from the outside. The pump is within the scrotum, the cylinders are in the penis, and the reservoir is within the belly or the pelvis. And all of these are under the skin, so you can't see it from the outside. The implant includes three parts, including the cylinders, which go in the penis, a pump that goes into the scrotum, and a reservoir which holds the fluid, and that goes into the belly or pelvis. And it is made with Bioflex material, which is a biologic polymer, and silicone, which is medical grade intended for implantation into the human body. The inflatable penile prosthesis holds normal saline, which is just salt water, which is physiologic in the human body. That is what is contained within the reservoir, and when you pump up the device, it goes into the cylinders to fill the penis and to provide the erection. In order to implant the device, we make an incision on the scrotum just beneath the penis. And from that one incision, we're able to put the cylinders into the penis, the pump into the scrotum, and the reservoir into the belly. Now, if you've had a prior pelvic surgery or treatment for prostate cancer, I may need to make a separate incision in order to place that reservoir. After the surgery, you will typically have a dressing wrapped around the penis and scrotum, a Foley catheter draining the bladder, and a drain coming out of the scrotum. And these will be removed the day after surgery with a clinic visit to our urology clinic. Most guys will feel better after a week or two taking pain medications, and then the device is typically ready to use after approximately 6 weeks. After the surgery, I typically see you in the clinic at 2 weeks and 6 weeks. At the 2-week appointment, I want to make sure that you're feeling okay and that things appear to be healing well. And at 6 weeks is when we can typically let you use the device, at which point I would show you how to use it. And we wait 6 weeks for the tissues to heal, and typically it takes that long for you to feel comfortable with squeezing the pump, as there will be some discomfort in those first few weeks after surgery if you were to manipulate the pump in the scrotum. So studies have shown that at 10 years, 80% of implants are still functional. Or that, put another way, 20% of people will have some failure of the device in the first 10 years after the implantation. The patient and partner satisfaction rates for the inflatable penile prosthesis are quite high, actually the highest for the treatment options we have for erectile dysfunction. Now, the surgery is more invasive. There is a surgery that's necessary for the implantation, but once it is in and it's working well, then it's easy to use. Spontaneity is one of the key benefits of an inflatable penile prosthesis, in that you don't have to remember to take a medication in order to achieve the erection that you would like. The two main risks with a penile implant surgery that I emphasize include that of infection and mechanical failure. In either case, you would have to remove the device and possibly re-implant one. The mechanical failure, as I mentioned before, is about 20% at 10 years out after surgery. As for the infection risk, that's about 2 to 3%, and if there is an infection, then it would need to be removed. Sometimes we're able to replace it.